Good morning, all. My name is Nina. I'm co-founder and CEO of Avena. In Avena, we're developing precision medicine solutions for chronic inflammatory diseases. Please meet Delphon. Delphon is going to be killed. He's going to be killed by a silent killer, but he is not aware. In Delphon's case, it's going to be a unique blend of chronic inflammatory conditions. First, he's going to get cardiovascular problems. He's going to go blind, and his kidney is going to fail because of the type 2 diabetes, which he's going to develop. And lastly, he's going to go mad because of the Alzheimer. So all of these diseases which I mentioned have a common denominator. They are all driven by the chronic inflammation. At the moment, and how it's all linked to the people in auditorium. So chronic inflammatory conditions are the world's greatest and the most costly health threats in the world at the moment, which means that 7 out of 10 people in this room are going to be affected at some stage by chronic inflammatory conditions. 4.5 billion people alive at the moment is going to die of chronic inflammatory diseases. And Thomson Reuters' latest report indicates that it's 47 trillion cost to the society of treating chronic conditions. So right now, the health system works really, really well for the acute condition, but it's failing when it comes to dealing with the chronic conditions. It's failing for the following reasons. It's acts too late, it's too imprecise, and it's also very costly, as you can see. The main reason for that is because it lacks of the tools which allow to detect disease at early stage, so giving this early warning signals of that the crime or disease is going to happen. And then also it lacks the tools to map out how the chronic inflammatory disease is going to progress. What would be the disease course? So what are we doing in Avena? So in Avena, we're here to enable the new healthcare model for dealing with epidemics of chronic inflammatory diseases. Our technology is built on 35 years research in Oxford, and it works a little bit like, I don't know if you guys seen this movie, I'm sure you have, The Minority Report. So our technology, it's like this precogs in the Minority Report. So it allows you to see into the future of the crime. So it gives this early warning signals of chronic inflammatory diseases from the molecular signals of the blood, from the blood sample. So at the moment, what we've been doing, sorry, the clicker, oh, yeah. So in Avena, what we've done so far, we built the platform which is enable clinicians and it's act as early clinical decision-making tools for mitigating CIDs. So we take blood samples. In our labs in Oxford, we process it using our proprietary tools, glycomic analysis. We create then our algorithms and data analysis, and we produce the reports which enable clinicians to make a more informative decision in terms of the treatment selections for an individual. Our solution is potentially scalable for all chronic inflammatory diseases, but in the last 2.5 years, we've been focusing particularly in these two markets. So our solutions is right now already commercialized and been used in the in regenerative medicine for rheumatoid arthritis. And as you can see, it's quite a large market. And then the predominantly business model we are using there is B2B, dealing directly with the clinicians and providing them with this report and informative decision making. And then secondly, we're also working in exploring reimbursement model for inflammatory bowel disease, which is a huge problem and many people is not aware. So who are we? I have a background in finance and entrepreneurship, so I had established my first company 5 years ago, which called WellCode Life, and it's in scientific wellness. And my co-founder, Dr. Dalar Fernandez, so he is a scientist in Oxford, and he's been working in this field of glycosylation and glycobiology for the last 35 years. We are supported by a strong team of the scientists and the product development teams as well. So what is our timeline and where we are at the moment? So our technology been developing for the last 35 years, and we received more than 1.4 million grant support to the date. We developed this GlyHealth concept, which is a foundation of our products right now and on which our technology is built upon, before we launched the company. And we also had some commercial trials in understanding how the market perceives our technology as well. We launched commercially our first product, which is Glyc Health Index, which right now can be purchased via B2B, via clinicians as well, in 2018. And we've been also acknowledged by receiving an award in the US last December. So in terms of our future, so right now we're working with people from NHS and then also the insurance who are going to be a payer for our platform. So clinicians and patients of CIDs are our users, and the people who are going to be paying for that is NHS and then also biopharmaceuticals, for which our technology can be used as a companion diagnostic. As mentioned before, we've been on this journey for quite a long time. So we set up the company in 2017. We got the first commercial traction. We're also looking into scaling up existing commercial products and also looking into raising money at the moment in order to explore this reimbursement model with NHS. But fundamentally, going back to the story, what is Avena about? Avena is about adding 10 years of joy to the individual's life. Delphond is actually my business partner who was able to predict and improve his health future. Will you? And I'm very welcome to join you in us in this journey. Thank you very much.